Welcome dear viewers to the video on modified release formulations. These formulations are also known as prolonged release, extended release, sustained release, and these terminologies are used interchangeably in the pharmaceutical formulations. So let's start with the video. The modified release formulations. As the name indicates, the release of these type of formulations is modified and it is controlled as per the required specifications. These specifications are made based on to the patient need for for treatment of the disease condition. The formulations in which the drug release is controlled as per the predetermined specifications are known as modified release formulations. The release rate is designed or controlled based on to the absorption and distribution of the drug required for the treatment. So if there is a disease condition which require the change in the release of the formulations for better therapeutic outcome, that time these modified release formulations are made. The modified release or extended release formulations are those formulations which release the drug over a extended period of time. These are also called as CR formulations or controlled release formulations. Then what is the need for making the MR formulations? Why the release rate is required to be modified, altered, or is required to be changed from the IR type of formulations? So whatever the drawbacks are there for IR formulations, those drawbacks can be decreased by the modified release formulations. These modified release formulations are made to improve the patient compliance and treatment outcome by less frequent dosing. So if any patient is taking IR formulation 2-3 times a day, then MR formulations can be made with the dose that is given once a day, so that the therapeutic outcome will be good and patient compliance or adherence will be good, or it can be improved. Then to minimize the side effects or toxic effects by minimizing the changes or variations in the plasma level concentrations that can be achieved by modified release formulations. To minimize the side effect toxic effects by maintaining the stable plasma level of the drug and by avoiding the plasma concentration variations. Then another important reason is to improve the GI tolerability by slower release. Sometimes if the IR formulation is given and if the drug is released at a time, then GI tolerability will not be there for some of the drug substances. Nausea, vomiting and other GI distress can happen. So those formulations can be, those APIs or those drug substances can be made in slower release profile with the technology of modified release formulations. To increase the duration of action by continuous release of the drug and ensuring stable plasma level in therapeutic range. So that is the prolonged action. Improvement of bioavailability of the drug. This can also be done with the technique of modified release formulations. Then another important thing is higher dose of the drug can be formulated in MR type of formulation. Loading dose and maintenance dose in a single formulation. So generally in MR type of formulation, the API's loading dose is given along with the maintenance dose. So loading dose and maintenance dose calculations are based onto the disease condition and the drug pharmacokinetics, and based on that the both doses can be given in the single formulation. Then come to the type of modified release formulations. Many types are there, like extended release, prolonged release, sustained release formulations, biphasic release formulations. Delayed release formulation is also a type of modified release formulation, controlled release formulation, and targeted release formulation. So in this, the ER, PR, SR, and CR type of formulation are those formulations which have longer duration of drug release. Biphasic release formulations are those which contain the IR dose as well as the MR dose. Targeted release formulations are those which release the drug at specific time or at the specific site in the gastrointestinal tract. Delayed release type of formulations are also the type of modified release formulations which are targeted for the release of drug substance in the intestine, and delayed release formulations doesn't release the API in the acidic environment of stomach. These are some of the type of modified release formulations. Then examples. So tablet formulation, capsule formulations can be made with the modified release formulations for oral drug delivery. Generally matrix type of tablets are there with monolithic or reservoir type of technology. Some tablets are coated, and coating or polymeric coating of the tablet controls the drug release. Osmotic tablets are there. GR enteric delayed release tablets are also the type of MR formulations. Pellets can be made or beads can be made with different release profile of SR, ER and DR as per the requirement. Bilayer tablets are there which contain the drug loading dose and maintenance dose, as well as bilayer tablet can have the IR and MR type of release profile. Multiple layer coated tablets can be made. Multiple layer coated pellets can be made to have the modified release type of formulation. In all of the modified release formulation, delayed release type of formulation, the polymers play very important role because these formulations are based with the use of polymers. Then the main limitation for modified release formulations is dose dumping or release of the more amount of drug compared to the specified amount of drug release, that is called as dose dumping, or loss of the modified release characteristics of the formulation, that is the loss in the release profile or not matching to the release profile. So these two are the main drawbacks or limitations of the modified release formulations. So this is regarding the generalized information and advantages and disadvantages of the modified release formulations. Let's meet you soon with such kind of informative video, and in the upcoming videos we will discuss the modified release formulations in much detail. Thanks for watching the video. Kindly do like, share and subscribe to Pharma Learning in Depth channel. Thank you.